We welcome you all to Talk the Talk. My name is Janine Steen.
And I'm Tony Ann Antoniato,
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome Dr. Neel to this episode of Talk the Talk. Dr. Neel is a holistic chiropractor, bodyworker, movement teacher, podcaster, and philosopher. He sees patients both in person and virtually, as well as teaches courses online and in person for both practitioners and patients. He trains body workers in his floor of mouth protocol and has begun a tour for this training, teaching across multiple cities and states. Dr. Neel is always eager to collaborate with other healthcare professionals to guarantee that patients receive the optimal care necessary for their health improvement and is passionate about helping nervous system function. Welcome, Dr. Neel, to this episode of Talk the Talk, and thank you so much for willing to be a guest on here.
Yeah, thanks so much for having me on. And I'm just like I was saying, it's like I just am excited to hang out with you and connect. And then yeah, thanks so much for inviting me and welcoming me to talk with you and all your listeners.
Yeah, thank you so much. I will just share with the audience. We had a little bit of a air conditioning issue here, so I'm a little sweaty. I'm without AC in, Long Island, New York, but I have a fan on me. So don't mind that part. We, got to make things work. And I was too excited to have Dr. Neel on here and didn't want to cancel that. And also Janine Steen, who is my co-host, she won't be joining us today. It'll just be the two of us. And I'm really excited to get some questions going here. Would you mind starting and just telling the audience a little bit about you and how you started in this field and how your career has evolved to what it is today?
Yeah, I mean, right now I'm sitting in Santa Barbara, where we live now for the last 6 months, California. Moved from Redding, which is the top of the state. I was there for like the last, it might have been like 14, 15 years. And then 17 years ago is when I graduated chiropractic college. So that's like a little brief timeline. I love being here. I'm working out of Santa Barbara Myo, which is Nicole Cantello's myofunctional therapy office. One of my favorite things is that even though I had my, own practice, own location for many years, since moving here, I just love being in an office where we're collaborating. And then also the same when I work in Woodland Hills, which is in LA, I work out of a lactation consultant's office, which is within an acupuncturist's office. And then I'm also working in Agora Hills, which is out inside of a airway-based orthodontist's office. So I feel like I love this.
Yeah.
Just the all the collaboration and cross-pollination.
That's awesome. That's, what makes all this really work, right? That collaboration.
Yeah. And I think 9 years ago, my daughter was born. Well, just a little bit over that. And when she was born, so 17 years ago, chiropractor started, and I was studying with the best and mastering that field. Then 8 years into practice, 9 years ago, daughter born with a tongue tie. That was it for me. Why I went headfirst into the field of tethered oral tissues. But it didn't start as that. It started with what is going on, and our midwife told us what was going on, and we're like, I've never heard of that. So I delved deep, did a lot of body work within a few weeks, but it was like 2 weeks in, we had a laser frenectomy done by Dr. Shervin Yazdi in the Bay Area. Awesome. And it was night and day for my wife with breastfeeding, and for our daughter Serenity with her ability to not only like feed and get the milk she needed, but also like not wake up all through the night with all that, gas in her tummy and all of the connected issues, and then nervous system regulation. I like to joke around and say, like, I got really good at beatboxing during those first couple weeks, because the only way I could like get her to calm was when I was like percussing with those sounds, because the normal singing didn't work because she was so in stress.
Oh my
So I
goodness.
busted out the beatboxing, and thankfully, even though I got really good at that for a while, after the release and then the body work that ensued, the post-op stretches and all of that, she didn't need as much of that to
Yeah,
soothe.
yeah,
So
yeah.
that's really what threw me in, and I started to like investigate what was going to help her. Yes, the release was amazing. Yes, those post-op stretches for like 6 weeks were really helpful.
Mhm.
But I started to see with the floor of the mouth that there was so much of a need to keep stretching and loosening it.
Yeah,
And I just kept thinking, there's got to be somewhere else in the body that contains this tension.
yeah.
And so as I went through her body categorically, and then all the babies, kids, adults, and my own other two kids, I started to build this library out of my notes that was 70 areas in the body that I found would correlate to floor of mouth tension.
Okay.
And the more I could find those areas and the syntax, like the order of operations, like in mathematics, to like work on these areas, the more I felt the floor of mouth tension drop, and that I would barely need to put any pressure or
Okay.
do much work in there to keep it optimized and help with all kinds of things with feeding. But of course, when there are those cases where the infant or child needed a tongue tie release or lip tie or cheek tie release, it made it so much more so much easier on the baby and the family.
Yeah.
So those kinds of moments spoke volumes to me because I'm always like a parent thinking, how can I do less to help this one more?
Right.
So like as it goes, that's my origin story of
Yeah.
like why I got into it and why I'm so like in it and like feel like it compels me.
Yeah, so passionate about it. So when you were already in your career, you were treating and seeing patients, and then you had your daughter, how much did you know as a chiropractor treating? How much did you know at that point about tongue ties, or was that something that really just wasn't taught to you at that point?
Right, it wasn't.
Okay.
And because I had been a family practitioner journeying with a lot of moms through pregnancy, fertility issues as an integrative practitioner through pregnancy and postpartum, I mean, I did, find that I was able to help some of the babies with feeding. But, I now, after that, after my daughter was born and I realized what was going on, I realized how many cases I missed, and I didn't even know that there was a such thing as a tongue tie until she was born. So retroactively, I'm like, oh, yeah, I missed so much. But as soon as I, started to see how much of a problem it was and became aware of it, then it became my focus 100%. And
Yeah.
so then I started to, yeah, so I didn't know anything,
Okay.
never talked about,
Yeah.
nobody ever talked to me about it. If they did, I didn't have open ears to hear it.
Uh-huh.
I just don't feel like it came up. But that moment was the kind of welcoming for me into the deeper work of like, now I got to pour over everything and study
Yeah.
everything and reach out to everybody. And that was kind of what birthed my collaborations with many people kind of globally is I'm just like, I need to know more about this, but also I'm seeing something here and I don't see anybody else like talking about these things. So I just want to like run at this to see how many people we can help together.
Yeah, that's awesome. Sometimes I feel like that is a lot of people's story is that they kind of, it found them, right? It found
Yeah.
you, you had your daughter, she had a tongue tie. And a lot of people I feel like have those stories of like whether it be a child or, a parent or something. And it's nice because it puts us in the shoes of the caregiver also,
Yeah.
like makes us wear both hats. And I can definitely speak on that too with my own child. But it is, puts so much more passion behind it because you're experiencing it on both sides.
Yeah, and I think I can think of so many people we know in common, like Melissa Mugno and
Yeah,
Suraj Batish and
yeah,
Jenna Davis. I don't know her personally, but all the things we've talked here and there, and
yeah,
oh, just so many people. How I'm like we're just people who care so much, either ourselves or
right.
others we know have
Yeah.
struggled, and through that struggle, we've found resonance, and also like we've got to figure this out because
Oh,
it is everywhere.
yeah.
So yeah,
Once you see it, there is no unseeing it. That's for
yeah.
sure.
Yeah. And I like to say about the floor, I was just talking to somebody else. Maybe I was talking with the dentist I was interviewing yesterday on my podcast, but with the floor of mouth, it's like once you see this airway issue, you can't unsee it. And I say with the floor of the mouth protocol that I've figured out in the floor for these four main areas that I've distilled down from the 70, once you feel it, you can't unfeel it.
Wow.
Like
Yeah.
when that shift happens, when you see
Yeah.
that shift.
Yeah.
But yeah, it's like um yeah, it's both I tell families when they come in and the families that I journey with, and of course I think about my wife and our kids, and I'm like, wow, I would love not to have had this problem.
Mhm.
I have my own tongue tie, and I would love not to have had this issue, and I would love for you, none of you, to go through this. That being said, it's there, it exists. So I'm so happy that we can, that like me and you and others, we
Yeah.
can support people through that because
Mhm.
there's so much to the village that's needed in terms of how we can really help people.
Absolutely. Yeah. And I'm sure you're seeing it as well, but a huge shift in this community in these last, maybe 10 years. So much more collaboration and all different disciplines. And of course, we are still educating and trying to reach people who maybe don't recognize signs of airway disorders in the pediatric population, or maybe still saying, they'll outgrow it or wait and see kind of thing when there's enough red flags out there. Signs that that's less and less now, and that there's more and more people and professionals being educated and wanting to know more about these topics.
Yeah.
Mhm.
Um, I was gonna say, yeah, I think even though I only started in this 9 years ago in terms of airway, tethered oral tissues, feeding, I do reflect on many cases, but more than that, those who, getting to collaborate with Barbara Green, who, the OG myofunctional therapist who started the AOMT, who's only
Yeah.
30 minutes away in Ventura, who's come in
Oh,
here and we collaborate, and she's also come in for care. Joy Moeller, just, who's amazing, and
yeah.
we've collaborated some, like I've been able to learn from these sages
Yeah.
who have not only figured out so much and how to help so many complex cases, but like Barbara, she's 83 and she's been
Yeah.
doing this for like 5 decades, and
Yeah.
it's like I just have steeped in like some of her wisdom, and hearing from them and others like the course of time and the trajectory of our human condition. It's like, yeah, this has been there and it goes way back. I see great grandparents, like, had the great pleasure of taking care of babies, the parents of the babies, the grandparents of the babies. And there's two families where I've taken care of the great grandparents, and all in the same room,
Wow.
and getting to treat them all and
Yeah.
seeing how it goes all the way up to those great grandparents. And like, I think we know, I'm like, if those great grandparents have these issues, and I'll speak to like, yes, the tethered oral tissues, but the narrow maxillae, and even the tori, I'm like, hands down, those are at least not just from the great grandparents, but they're from great great or great great great, who
Right.
knows.
Right.
So it just goes back so far. So I know that this has been a really big issue, that has been around for it seeming, so long. And yet at the same time, I know that there's been a steep increase
Mhm.
in the prevalence of these issues with the pharyngeal arches and mouth formation that happens at that 4 or 5 week, in utero gestational period.
Yeah, exactly. Yeah. It's like that perfect storm in a way. We're getting more aware and more educated, but it's also more common because we're not, just how life has evolved, and we're not eating the food
Yeah.
that we, should be eating and all that stuff. So, yeah, absolutely. I know you, obviously, we touched on tongue tie a little bit and narrow palates, malocclusion. As a speech pathologist and a myofunctional therapist, that is a lot of what we see in our patients, and we treat them through, myofunctional therapy, obviously, and any outside referrals and collaboration. So, how, as a body worker and chiropractor, how do those areas impact someone's body tension and nervous system function? What are you seeing, and how are you supporting
Yeah. And, like Nicole here and many other myos and RDHs and SLPs, like I'd love to be in that conjunction of care, that collaborative care, or like Kevin Boyd and Shirley Gutkowski say, shared domain. Um, because I have so many people who come in now and they know that this is what I do. They're coming in from all over. They're being referred. Sometimes they've seen, my range is like they've seen 12 to 40 people sometimes for this
Okay.
issue.
Okay.
And so I'm like, okay, well, there's a lot of stake on this,
Yeah.
but this is what I love is to help people. So I do tend to see like a very intricate, complicated, milieu of issues,
Yeah.
and people are wanting to rely on me for everything, and I say no. I want to defer to the Mayo you're working with, or Nicole, or whoever, and your SLP, and your the various providers, of course, the airway dentist or ENT you're working with, but you're here. So um so I'll speak to a lot of the issues, but yes, if I narrow in to this very pivotal area that I've focused on, which we call the oral diaphragm, the functional diaphragm of the mouth, um, I see that I look at it like an aperture or a window and a lens that I can see. When I look there, I can see and feel how the whole body interacts with it and vice versa. So that's why if I see like the left piriformis muscle is too tight, and then the right, pelvis is rotated externally, and there's this foot flare, and the calf muscles and the soleus muscles in particular are really tense where they adhere to the tibia, and they're known as the second heart, controlling so much more than just lymph and blood flow. I know, like, yeah, chances are there's pharyngeal arch issue formation issues. And if I see the left trap is tense and the right SCM is more tense, if I see the manubrium of the sternum is misaligned, if I see, the right sphenoid more restricted than the left and tends to be the right lacrimal, right ethmoid, right zygomatic, there are anomalies where it's the other side. But in like 97, 99% of people with tongue tie or narrow arches or tori, I see this pattern.
Wow.
And so I see those things and I'm like, okay, whew, that's a lot.
Yeah.
Thyroid, parathyroid gland misalignments. You might have the esophagus, the right aspect of the diaphragm, the right kidney way more than the left kidney, and then you have the ileocecal valve of the colon, and there's so many issues. The right clavicle tends to be internally rotated, and the right scapula tends to be externally rotated, and the humerus tends to be more anterior.
Mm-hmm.
And yeah, we have that glossopostural syndrome. But one of my biggest things to think about and talk about, and some others are talking about this, like PRI and some other amazing people, is that we are born asymmetrically. We have different organs on different sides, and our tissues don't form symmetrically, even though we want symmetry in all these processes we're talking about, expansion, et cetera. But we're born asymmetrically. So when we have tongue tie, floor of mouth tension, and all these issues, it takes what's already asymmetrical and it contorts it into this spiral pattern. And so what I spend a lot of time with is identifying the spiral in all of the ways that it shows up, very tactically listing it, knowing it, and then finding out, okay, but I can't work on 70 areas on everybody. I can. I mean, that's why I have some people come in for 3-hour sessions. There's even a chiropractor who came in for a 9-hour day, and we did body work for 9 hours, and it was a lot.
Wow.
But I need to find out, but where is the area, or where are the areas that are most inhibiting that floor of mouth from being supple? Because the oral diaphragm requires suppleness, not only so it can be loose, but so that hypotonic or weak or hypermobile areas can get more strengthened and actually work better. So that's when I'll find, ooh, if I release the thyroid first and the kidney next, and then the right foot next, and the right big toe after that, and then the floor of mouth tension dropped so dramatically that impresses some people. But most people, like, they're not like, oh, that's amazing, right? It's what happens after that.
Yeah.
After that, then the orbicularis oris muscles elasticize. The debuxinators go, I can pull their lips over their nostrils, but that's not like nobody's excited about that. But the right sphenoid frees up. And so then the 70 areas in the body can melt and become more supple. And one of my favorite areas to look at is those inner thigh muscles. They just become so much looser, and the calf muscles turn to butter. And people are like, whoa. I had
Wow.
a dentist on the table back in LA, and she's like, what just happened? Like, she's an
Wow.
airway specialist,
Yeah.
sees so many people, works with amazing body work. Me too. I get to collaborate with the world's best body workers, and I defer to them. But with this little flow I figured out, and I feel like it was a download that I was given, it's just crazy when it happens, because it's like what it just becomes this reality to where we can become so supple that not only do our bodies loosen, but our tension leaves, so our nervous systems become way more regulated.
Mhm.
And then, therefore, I say to people when they're on the table and we have this flow happen, usually this floor of mouth protocol takes, once I evaluate them and we go into treating them, like I'll evaluate them for like 45 minutes and I'm gently working on areas to test into these hypotheses. And then I'm like, all right, now we're going to start. I'll start in the mouth, work on the body. Within 5 to 15 minutes, we've gotten to that point to where elasticity body wide happens. And then I say to them, all right, now we can start. Now we have access to your body
Right.
and we can really begin to help you with the problems that you came in with.
Wow. So amazing. I mean, it's just got some a lot, like so much, but it's just it's really inspiring to hear you talk about all of that. And I think for anyone listening that might not fully grasp all of it, it's like noticing that we always hear the fascia, right, connected from the tip of your tongue to the tip of your toes, and have a whole body. And that's basically, I mean, what you're witnessing and experiencing
Yeah.
and helping patients with, which is,
Yeah.
yeah.
And I would give credit to Tom Myers in Anatomy Trains, who wrote such a wonderful treatise on fascia, rolfing, structural integration. He's the one that is responsible for that image that we see with
Yes.
the fascia
Yeah.
from the tongue to the toes.
Yeah.
Michelle Emmanuel, another amazing healer body worker, who's come out with one that has a baby image that shows the lines. And then I have the airway map, which I've
Okay.
created, that I've put in different iterations, and I'm teaching it in my online course and at my in-person trainings. And it has this connection that goes from the floor of the mouth. Of course, the tongue is the counterpart there, but it goes up through the palate, up through these cranial diaphragms, and there's 3 diaphragms in the head alone.
Okay.
The mouth is a diaphragm, and then we have many more throughout the body, including the pelvic floor and the feet. But I have this diagram that shows these through lines run throughout the body to the fingertips down to the feet. And so I believe I'm like riding on the shoulders of those giants, and
Yeah.
I've created what I call a multi-tissue system map that involves fascia. And I love giving credit to fascia, but I feel like what I've seen is that the more we can talk about the visceral system, the organs, and the more we can talk about even the muscular system separately from the fascial system, and then the osseous system, which is obviously bone. Yeah, we got lymph, and yeah, we got nervous system, and we got the glymph, which is the glial cells in the head that forms the lymphatic system of the head. Um, One of the things I love to talk about is, sometimes, I know I'm getting into the thick and the weeds of
Yeah.
this, but the osseous system is so significant. And some people might think, well, you're a chiropractor, sure, you're going to talk about bones. And I'm like, hey, we owe credence and credit to the osteopaths to talking about bones. And I have studied with many greats, and I take care of countless osteopaths in my practice, because they say, Neel, you're more like us than you are like a chiropractor. Well, I love chiropractors, but yeah, and I work on all the tissues. And so when I'm working on the tori specifically, this is what I teach in my training.
Okay.
There are those who have those mandibular tori that are occluding what I call the floor space, right? I
Yeah.
know it's not that clever, but it's the floor space. And you can work on the floor and you can free up fascia here and throughout the whole body. But if they have mandibular tori that occlude the whole of the floor space, sure, surgical intervention is a huge likely need.
Yeah.
But for me, that's true, and I've worked with a lot of patients with that. And
Okay.
the floor four that I'm teaching them how to work on these 4 main areas if you work on them, you can create such change in the floor of the mouth without working on it
Wow.
that you can help them so much if they don't want to get surgery, because I have those who don't,
Yeah.
or if they don't have access to it. But my other thing to mention is that when those bony growths that occur, I like to say through clenching, grinding, and I'm speaking to the choir on who could talk about bruxism and things like that. However, I've seen so many infants with the mandibular tori, and then I see their parents and grandparents, that I know there's a massive genetic component of this. They come into this world with tori. So where I see a lot of failed tongue tie releases from the best providers out in the world, or they do great work, and then it's the patients need serapeptase, so they need, baby lace and oralace, and they need, all the things, maybe even Kenalog. I love that, and I hands down defer to these providers who are phenomenal at that. But what I see often in the most overlooked area is not only to work on the floor four, which, you know, the world doesn't know it yet because I have yet. That's why I'm doing this tour and I'm teaching
Yeah.
it.
Yeah.
But is that the mylohyoid line, which is where the tori originate and grow from,
Yeah.
that tissue, it's a place in the body where the periosteum, which is the bone, needs to be worked on very specifically in order for the floor of the mouth fascia and muscular system to let go, so that that anterior digastric in the front of the floor of the mouth to loosen, to prevent that rigid, tense area that happens post-op when even the best releases are done and even the best body work is done. So I'm really specific about the osseous structures, because sometimes the bones need to be worked on. And maybe the last thing I'll say is that some people are like, well, but bones are bones. And I'm like, they're very porous. And if we look at that at a molecular level, we have so much osmosis and so much gaseous exchange that's happening through the bones that you'll hear osteopaths and rolfers, or structural integration specialists, which is what I involve in my practices, all those fields. They will talk about working on the periosteum as a way to truly create more suppleness and create matrix changes in bone. So that's for complex cases I'm seeing. Yeah, the scenario that we need to talk about. Anyways, so my floor of the mouth map includes all those tissue systems and the interactivity between them. And I'm really excited to kind of like show that and
Yeah.
let that be a thing that's known, hopefully, from
Wow.
here on forward.
Yeah, I'm excited. I'm excited to see your work, and maybe any plans on teaching in New York anytime soon?
Oh my gosh, I so would love to. There's a lot of people out there that have asked, and even Brittany, Brittany Sierra Murphy over in Connecticut, we were
Yeah.
talking about it. I so am tempted. So,
Yeah.
but what I want to say for sure is I'll be speaking at Myosphere in
Oh, nice. I will
2026.
be there. Yes, I'm
Okay.
speaking there as well.
Oh my gosh, so
Yeah.
cool.
Cool.
So guaranteed I'll be talking about the floor for there. So if anybody
Yeah, I'm
wants to come,
excited. Okay.
that's the next trip that I'll be at, the East Coast. And then I don't know, we'll see more from there. But as of right now, um, family, work, life balance, I took off my November trips to Texas and Florida so that I could just say Chicago is my last training of this year,
Okay.
for the floor of the mouth training. I do
Okay.
have local ones in LA that are like 4 hour modules on August 30th and November 1st.
Cool.
Then I'm kind of saying next year it's Santa Barbara. So if anybody wants to come, you got the best beach in the
Yeah.
world, or one of them. You
Yeah.
got like beautiful Mediterranean climate. So I'll be doing trainings here in my home city.
Okay.
But there's a few offices that have reached out and have said, could you train my whole office? And
Wow.
I've said,
Yeah.
yeah. So if people set it up, curate the
Yeah.
experience, and invite me out, I'm going to be doing a lot of more speaking engagements and customized trainings. So I'm not going to say no if the timing is right and all of the
Yeah.
details. But the Floor of the Mouth tour was quite an undertaking. I've been to, Reading is where I started it,
Okay.
which is where I lived, up at the tip of California. But then, Denver, and then I went to Phoenix, and then last month Boise, Idaho, and then now Chicago. So it's been a lot, but I'm really eager. There's a lot of amazing people, and I think that I know like body workers have come because they want to learn. It's massage therapists and chiropractors, osteopaths, physical therapists, and but then some, there are CST, CFT practitioners, or MFR, John Barnes work, or Bowen workers, or they're myofunctional therapists who have added on that training, or they're dentists, or lactation consultants. And so that kind of whole, and there was even a naturopath who attended the training that I did in Phoenix.
Okay.
So it's really like, yes, everybody's going to get hands-on
Yeah.
training,
Okay.
but it's really about two things. I have to make sure I say these two things of like, yeah, it's not even about the body work. It's about the paradigm of understanding this. And once you see it,
Yeah.
you can't unsee it.
Right.
Once you feel it, you just can't unfeel it. And it changes the way that we see this work, and we see the airway and feeding work and world.
Yeah.
And then I also have huge components of making sure that I'm involving teaching people how to tap into their intuition,
Mhm.
trusting your inner voice, trusting that, you know, area of our mind and our heart that sees what our minds and clinical experience can't see.
Yeah.
So that connectivity with our patients, with our people. And I really take time in the trainings to cultivate that, because I wouldn't know any of what I know if I hadn't been taught by my daughter, the greatest teacher with her tongue tie issues, also tuning into my wife and what she needed, and then tuning into that intuition
Mhm.
that would share with me, Neel, do this.
Yeah.
Okay. And that I want to make sure I say, like, I couldn't figure this out. My mind would not have figured this stuff
Yeah.
out.
Right.
It was through cases after cases after cases after
Right.
cases, but they
Mhm.
wouldn't have happened if it wasn't for leaning in and trusting
Yeah,
that
I
intuition.
love that. I love acknowledging that. And, we all have that as practitioners and therapists. And sometimes we don't always trust it, right? We think like, am I, really good enough to listen to that? So I think that's a really powerful part of that teaching, which is wonderful. Um, as a speech pathologist and doing myofunctional therapy, what are things, and any therapists listening and tuning in, what are some things that we would really look for and what we're seeing with our patients that would maybe mean, to have this further looked at and clarified?
Yeah, it's such a good question. And with just a person who was in here today, um, the hyoid was such a significant part of what was locking up her whole body. The throat bone, right? It's,
Yeah,
it. I'm
yeah,
preaching again to the choir of, it's such a very phenomenally important bone, and it's a floating bone, and it does not connect to any other bones. And as um, the floor of mouth has these, the suprahyoid, infrahyoid muscles, I think anytime we notice tension, I say if we feel tension here, that could be the thyroid. Up
Mhm.
here could be the parathyroid. But then behind that, inevitably, is going to be the hyoid. And once we free the floor of the mouth some, the hyoid lets go. And then it can be worked on even more. So definitely those things. But I'll give you like one thing that I find hugely significant in a functional evaluation that's applied function from the floor four
Yeah,
is if you check tension here, as we know, we talk about the scalenes and the SCM muscles and all these accessory compensatory muscles. But if you feel right here, this cartilage, the thyroid and the parathyroid, and you just feel here, some SLPs and myos were like, Neel, I'm not like you. We haven't had all this training. I haven't felt the tissues as much. And I'm like,
yeah,
I know. So if we pan out and just feel, and
right.
then have people go into lingual palatal suction,
Okay.
and then feel what happens. Feel what tenses up, and feel, you know, so if you're just at, normal resting posture of tongue with
Mhm.
mouth closed, feel from side to side. You can even feel from front to back. Then go into lingual palatal suction and feel what changes. And you might feel everything tightens, or you might feel, wow, it got way easier to push that way and way harder to push that way.
Mhm.
And what I'll say is that you're finding the compensatory, functional changes of the visceral restrictions in the thyroid, parathyroid to tongue tie or any of the other issues with narrow arches. So that's a time when that person needs very like intricate body work to those organs.
Okay.
And you could just say some people will go into that and they're in that suction hold and they're feeling like it stresses and strains their body. And so a lot of people think, well, then they need a tongue tie release, and that's really what it's going to be what helps them. And they've tried all the myo and they've tried all the body work. One of the most overlooked areas in terms of organs is the thyroid and parathyroid and how significant they contribute to these issues. So, kind of just to say that adding the functional check and the evaluation and even just gently checking can sometimes loosen up what was so restricted and rigid and wouldn't let go. I think the other things to think about are some people, when they go into lingual palatal suction, just it's the roof of the mouth, and some people know the maxillae and the palatine bones, and they have that hypersensitive gag reflex, and that's just preventing the therapist or the person from being able to relax. Well, often it's the thyroid and parathyroid, when gently worked on, that can desensitize a hypersensitive gag reflex.
Wow. Okay.
There, all the other areas of the floor four can also do that.
Okay.
But sometimes I'll say, sometimes when that's not working, violet light on the maxilla helps dramatically. And some people are like, where do I get a violet laser? I'm like, well, you could buy one. I have a great reference for one. However, every sunset has the color purple in it. So if you go outside, I have so many patients walking outside going, just getting the sun on the roof of their mouths. And they're like,
Wow.
that just relaxed me so much. So sometimes you might have that hypersensitivity and that vagal hyperactivity be somewhat stilled and helped by a little simple purple light from the sky. So those are just kind of like my way of saying like some unique areas that you could think about looking at if you're in this area of expertise.
Wow, that's so cool. We'll know that they're coming from Dr. Neel if they're walking around at sunset with their mouth.
Yeah. Well, I was like, you know what? We were probably doing this. I taught my kids when they were one. I said, basically, look up at that tree, and they would look up, and then I was like, can you smell that flower? And they would go, right. And so then they're breathing into the nostrils.
Yeah.
And it's the hardest thing to tell a kid is like breathing through your nostrils. They're going to understand that. But I think also, like, the more I look up at that blue sky and wide-eyed wonder, I'm like, mouth open, like awe. I think so many of us have kind of like, we kind of have to remember to get back to some of these basics of being awed by creation, inspired by one another. So I think some of these things are just reminders of getting back to these rhythms that we kind of have always had, that sometimes are a little bit harder to come in contact with when we are, especially when we have stress and nervous systems that aren't regulated and all those things.
And I mean, again, back to how life is right now, and getting back to the simple stuff of just being outside and having your shoes off and, just enjoying the air and letting kids get dirty and, let them play in the dirt and play in the grass and all that good stuff.
Yeah, and the electrons that flow from these elements of Earth are massively important. Like, we need negative ions equals, electrons, and that's what grounding does for us. And so I know people talk about, like, in LA, it's hard. People don't have real grass, right? And I'm like, I'm so sorry. Do you have a plant? And they're like, yeah, there's dirt. It's living. Electrons. I've had patients put their fingers in a plant.
Wow.
And in an instant, I've seen the floor of the mouth loosen, the tongue let go some, lips and cheeks and pterygoids elasticize. A dentist, Rachel Barnhart, my amazing collaborator in Reading, that it's sad to leave behind up there. She's doing amazing work up there. She came in one day, and she has all these, she had double MMA surgery. She's her own patient, right? So her mandible was way offset, and I'm like, what's going on with you today? We had it way loosened, and so then checked. I muscle tested, and went through my own intuitive sensing, and I'm like, you're lacking negative ions. And I'm like, okay, we need to get you some of that, because I look for instantaneous change to change the floor of mouth so we can get access to the body. Ran outside, grabbed a pine cone, came in, had her hold a pine cone. Pine cones that have fallen from a tree recently still have negative ions. They still have electrons. So she held the pine cone and instantly her pterygoids loosened, her floor of mouth tension loosened, and her jaw went from to there. And I'm like, I didn't do anything, right? So it's always awesome when I know that I didn't do the change. She needed the negative ions.
Wow.
Sure. Then I went in and worked very intricately to get the rest of that,
Yeah.
TMJ and the craniofacial structure in alignment. But I think it is really amazing to see how we sometimes need that grounding, both like the emotional
Yeah.
kind of grounding,
Yeah.
but also that nervous system and the electron transport that comes in. And so I do a lot of delving into that, beyond my floor four protocol, where I look at pathogens, toxicities,
Yeah.
EMF. I look at, primitive reflexes. I was just talking to Suraj in a WhatsApp thread about primitive reflexes and some of the things that have been ripe for his book coming out. And so, we can talk about all of that. And I'm like, yeah, but it can seem so complicated that we have all these exercises and these stretches, and I got to go outside and ground, and I got to do this violet laser. And I'm like, actually, 30 seconds of purple light works so dramatically that that's all I recommend, 30-second installments.
Yeah.
But also, I'm like, you might not be able to get all these tools. And so I do think that sometimes the floor of the mouth protocol kind of is a quick way to bring relief to all these areas that can
Yeah.
sometimes require a much longer process. But to not plug my own protocol, it's like, I think it can feel overwhelming and complicated as both a parent or a patient or a practitioner. Like, how am I going to really get this person everything they need?
Yeah.
I have some people who are spending inordinate amounts of money and they have everything in the world. I have other people who can't get what they need. And that means, what can we do? How can we most make this impact where we know that? And so that's why I love like saying, thank God for Instagram and for people's feeds, because I like tune in and I learned so much from that. But I think if we can like do a little grounding, and if we can connect with people we love, and if we can trust our intuitions, we're going to find what we need. And we're going to also know that somebody like this patient who came in today and she's like, what's going on? Why is everything out of whack? And we know that she's going to see Nicole for the myofunctional aspect of this. And I'm like, well, in this moment, your right inner thigh muscle was so rigid that it was compressing everything. So we unlocked her right inner thigh muscle, and so much of the craniofacial distortion let go that 90% of the work was done.
Wow.
So it's a little bit of stretching, testing in, seeing where do I feel the most restricted. And a lot of people are tapping into that. So I think it's really nice to know that sometimes we just check and test and see how we're feeling and work into those tense areas, because fascia can unlock so much. And then I have tongue press, which is a really simple way that people can check the mouth, check the body, and learn about the floor of the mouth a little bit. I have a promo going for like $20 for that course. And so some people jump into like floor of the mouth, which is really good for practitioners, but a lot of practitioners will be like, that's great, but it's like so in depth. So tongue press is like a really simple, I think it's 4 videos, 5 audios, a PDF, and you can just learn simple techniques to free up some of these areas. And then I'm really coming out with a floor 4 soon, which is going to be the second part of that, which is teaching everybody how to free up these 4 main areas so that in some way, if you can't get to us, you can cover the main areas and at least find this relief that is hard to obtain at times.
Wow. That's amazing. And are you, when you're, teaching these and doing these, are they things that your patients can do on themselves, like in between sessions on like a daily type of basis?
Yeah. The parents who bring their babies or kids in, I'm teaching them, here's how you work. I'm showing the parents in their mouths and on their bodies what to do. We take video, show them what to do on their babies, show them what to do with their kids. And then for the people that, for the patients that are, a little older kids and adults, I'm showing them, here's how you do this. And if you do this like once a day or once every few days, you're going to make significant change. So that way, if you don't get to see me for another week
Right.
or two or a month or whatever, you have something that's really going to help you on a day to day.
Amazing. That's great. Wow. So what about, obviously again, as a speech therapist, and we're working with a lot of children that have difficulties maybe regulating emotions or, sensory issues. Do you find that you're treating those types of patients and it's making a difference there as well?
Yeah, and I do think it really does go so hand in hand with like um these issues of lack of oxygenation, lack of nourishment that can go back to, these origins of tongue tie. But it's not only that, it's there's a huge overlap.
Mhm.
And so sometimes when I'm seeing this little one or an adult, and it's like there's so much tension or stress, right? I'll go into, okay, I'm checking your body, and then, I'll ask, and then I know you said you have a lot of stress there, or like what's going on with that. And so there are those moments where just even them uttering aloud what's going on
Mhm.
can not only bring validation to what they're doing and going through, and I hear it, but I'll find the changes in the floor of their mouth and I'll see. And so we can lean into that a little bit more and know when I need to ask more about it. Obviously, I refer to counselors, refer to OTs, PTs, and all the SLPs to the right people. But when it comes to like that nervous system where it's everything's ramped up and the sensory issues, I guess that's one of the things I care so much about because I really look at the lens of the floor of the mouth. Why is it tense? How is a sensory issue interacting? This one little baby, after a tongue tie released, mom brought her in and where she was like, she's really cringing with the stretches. And I'm like, okay, that's telling me there's something going on. And the floor of mouth was so rigid. And I'm like, well, but it's not this and this. And I checked some of my main areas and I'm like, no, oh. And so then I muscle tested into the sense of smell. And I'm like, I think she's got, and is she really nervous or startling with sounds? And she said, yes. And so we could talk about primitive reflexes or retained neural reflexes. But in this case, I said, let me experiment. So I brought over a candle and she smelled the vanilla candle. And as soon as that little girl smelled the vanilla candle, her floor of mouth became more rigid. So, so the way I work with that is violet light. I got the violet laser and was able to shine that violet light intranasally for seconds. And within seconds, her floor of mouth loosened. And I held the vanilla candle up, and it wasn't um, creating that.
Right.
And so then it crossed over to helping her auditory sensory processing issue as well.
Okay.
There was
Wow.
another boy who, yeah, he was having trouble. The dentist was like, there's no tongue tie, but I don't know what's going on. And it really was like that tongue was so mobile. And if anything, he had hypermobility, but that doesn't mean it didn't coexist. I found that when he smelled odors, his tongue stiffened.
Hmm.
So I was able to titrate his ability to smell, shining the violet laser intranasally, working on his tongue, so that when he smelled, his tongue didn't stiffen. So he was getting one of those faux oral restrictions that was coming from the sensory capacity.
Yeah.
But yeah, and then I had somebody who the only way I could get his sense of smell back is he had tongue tie, narrow arches, etc., traumatic neck injury, and fractured his cervical spine. The
Wow.
only way I could get his sense of smell back after he couldn't smell for over 18 years
Wow.
was shining violet light intra ear while working on the floor of the mouth and the pterygoids. And then after that, his smell came back and it
Wow.
was crazy. So I do rely on violet light for these tricky cases,
Okay.
but sometimes it's just the floor of the mouth,
Yeah.
releasing tension there.
Wow.
And the brain has a chance in the brainstem to alleviate that strain and stress and tension. And then that right neural input happens, the integration happens, and I see reflexes just happen. And some of these parents have been doing these primitive reflex exercises for a year. And
Mhm.
I love some of the most amazing experts in that field, and I love referring to them. But when I see people And I'm like, but yeah, there's something else.
Yeah.
It's connecting these areas of the body and working with them that I often see the brains of these little ones and people connect and finally make it past these like hindrances and these hurdles and these struggles.
Yeah, absolutely. Putting all the puzzle pieces together.
Yeah.
Wow. Well, I know you mentioned a few of your trainings and courses. I feel that people listening will absolutely want to learn more. And, where can they go exactly to find your courses and maybe give some website or Instagram information so they could do that?
Yeah, definitely Floor of the Mouth and Neel Neil. If you Google that, you're gonna find me. Dr. Neel Bulchandani is my Instagram. That's where I'm like at the most. I have my podcast called Compromise to Alchemized, which I love. Interviewing healers on there. My website, you can find it through those ways at neelbulchandani.com. But and then I have like ways that you can work with me, which is coming to my in-person trainings and then my online courses. But I do virtual like one-to-one sessions and I guide people virtually all the time. And that's a really great way to like problem solve complex cases. Or sometimes I have practitioners, myos, reach out and say, I'm struggling with this case. Can you get on a call with me? And I'm like, absolutely. And I'll be able to see and test that way. And then what I'm talking about a lot now is I've had just this family come from Phoenix and they brought their little one right before a tongue tie release. And
Okay.
they themselves were like, we also would love sessions. So they came,
Okay.
flew in, and we did back-to-back sessions. So I have a lot of people coming in for that where they fly in and or drive in and they'll do like these adults did like a 3-hour session the first day each, and then 2-hour session their second day. And then their daughter did an hour session each day. And I call it the life reset, but it's like a calibration, a tuning in. So encouraging people, hey, if you want to make a trip to Santa Barbara, I also do a more involved version of that where it's like a retreat where we do sessions over a day or two. We go out to the beach early morning if you want. And I do an hour of, we go through mapping your body, your brain, and through your mindset. And then we also look at your movement patterns and I help you rewire your movement patterns. And we do video so you can go home and you can carry that work throughout. So, and I find if I solve those most complex, tricky to find issues, then I just relay things so that they can take those findings to their body workers and healers and then carry on that work too.
Wow. Well, strategically, you're in a great place for that, right? And
Yes.
everyone wants to go on vacation there. So it's a win-win for sure.
Yeah.
Wow, that's amazing. I'm going to have to absolutely look into planning a trip. That's for sure.
Well, yeah, and I hope we connect soon. I feel like we have so many people in common, so look forward to talking with you about that, and then seeing you at Myosphere at the very least.
Yeah, that would be awesome. Thank you so much for joining me today and taking time out. And I apologize that I'm again in this unair conditioned space, but that didn't impact the conversation, of course. And I'm really excited to get this out to the listeners. I know I learned a ton, and they will learn as well.
Yeah, well, you did like. You looked like you did a comfortable, phenomenal. So I feel like you were able to work through your situation to where I don't think anybody felt it at all. So you did really well. Thanks for hosting me, and for graciously welcoming me on and talking about all these areas that we have this shared passion over, and really enjoyed our conversation.
Yes, thank you. And I look forward to hearing more about what you're doing and definitely connecting, at least at Myosphere when we're there together.
Yeah, I look forward to that.
Well, thank you, Dr. Neel, and we'll talk soon.
Sounds good.
All right, take care.
Bye-bye.
Bye. Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, SpotPal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.